First, let me say Ni hao ma to my colleagues, our colleagues from China, and just give a bit of a context to the program. China is changing, and China is broadening and is reaching to the world. And what we saw during the Olympics is an example of how China is an amazing country. And in that context, at one point 3 years ago, they approached, after doing much homework, they approached RNAO and asked us if we were interested in joining, in partnering, both in sharing and learning one from another, as well as sharing with them the expertise we have in both clinical and leadership best practice guidelines. So about 3 years ago, I said to my dear colleague, Imogen Bainok, Director of Nursing for International Affairs and the Best Practice Guidelines Program, let's go and see what's up. And we went and we met initially in a timid way to see where things will take us. And soon we discovered that there is a lady in China, Miss Yang, we call her. And Miss Yang is what I would call a modern Florence Nightingale of China. And I want to make sure that we mention her name because she is key to the success of this program from the China side. And this woman, which is a very humble but very important business person in China, she is not a nurse, has a vision for nursing. And she calls it voice to nurses, she tells us, voice to nurses. And by that she means voice to nurses in shaping the healthcare system of the future and voice to nurses in terms of ensuring quality patient care. And that is exactly what we have done with nursing here in Ontario. So all we are doing really is sharing what we have done in Ontario with our magnificent leaders in China, and we are absolutely certain that they will have similar successes there. The type of partnership that we are having at this point is a long-term partnership that entails we developed here at RNAO specifically for our Chinese colleagues a leadership and management train the trainer certificate. So it has numerous modules, about 18 modules, and what we do is teams of nurses here, led by Dr. Imogen Bainok, train the nurses there, and at this point we are going from hospital to hospital, and the 4 interns that you see here are actually 4 graduates from our training program, graduates that now helps us train other nurse leaders in China. Now we need to remember, China is a big country, only 1.3 billion people, right? And within that 1.3 billion people, they have 1.3 million nurses, of which about 60,000 of them are nurses that work in management. So when we are saying a long-term partnership, of course it's long-term to train that number of nurse leaders for now and for the future. In addition, I want to tell you some exciting news. In October 21st, 2nd, 3rd, and 4th, we are having our first joint international congress in China with our Chinese partners, and it's turning to be a most exciting event with people coming from about 10 different countries to present papers and to share and learn in the expertise and knowledge. So we are tremendously excited to have you here. We are delighted with the results that we already see after a relatively short term, and we know that the future bodes well both for the nurse leaders in China and equally, if not more important, for their patients. Let me introduce to you Ms. Yi Yu Li, Tina for us, that will, as Irma Jean said, she works in the Basic Nursing Education Department in Capital Railway, and she was sharing with me, and I wish I had here all the faculty from all the schools, Irma Jean, because she was sharing with me the workloads that she has in terms of about 16 classes a week sometimes to teach students. So Tina, please, on behalf of your colleagues, bring some remarks. Thank you.